Welcome into the Sports Objective Podcast, a very special evening here. As Bubba, we have a very special guest.
Absolutely. Very excited to have with us Dr. John Bream, product of the ECU Brody School of Medicine. Dr. Bream, welcome in.
Thanks, guys.
Welcome,
Good
John.
to be back with you.
Absolutely. By the way, guys, right before we came on, I checked, and the Fountains of Wayne lead singer, passed away today of complications from the coronavirus. Of course, their big hit, Stacy's mom. So very sad to see it. Yeah, that was just happening.
I'll tell you what, it's taking a toll on the music community. You got him, you got Joe Diffie. Do we lose Dr. Bream?
I think so, but
no, you're good. I'm here. I can't hear Dave for whatever reason. Sorry, I was just trying to text you instead of say it out loud.
Okay, can you hear me now?
Are you hearing Dave yet, John?
Yeah, I've got my volume all the way up. Can you guys hear me?
I can hear you.
No, for whatever reason, I can't hear a word Dave is saying, but
I can hear you, John.
The audience can hear everybody. So, John, can you hear me?
Yeah, I can hear you and Bubba just fine. It's just
okay. You can hear Dave. All right. Well, we're just gonna have to relay. If Dave has a question directly for you, we'll just have to relay it.
All right, sounds good. Roll on.
But yeah, what he was saying is the guy that was the lead singer of the band that sings Stacy's mom passed away for complications for the coronavirus. So it's taking a toll on the music community with him, Joe Diffie. You have Jackson Brown who has it.
Great.
Good news for Jackson, though. We did find out that I read today it's just a mild case.
Yeah, you got Tom Hanks and his wife, and the Boris Johnson, and several other people. This virus is certainly not discriminating based on any sort of factors whatsoever. Other than kids seem to be doing well, but this virus certainly doesn't discriminate.
John, tell everybody before we get too deep into this, who may not be familiar with you and who you are.
So I am a practicing emergency medicine physician, board certified, residency trained at East Carolina's Vidant Medical Center. Attended Brody School of Medicine and ECU for undergrad. And I'm currently the medical director at Novant Rowan Medical Center in Salisbury.
All right. Now, before we get too deep and we start taking questions from the viewers, just give everybody an update on how things are going in North Carolina. If they haven't heard the most recent numbers in terms of cases, those hospitalized, and the deceased.
Gotcha. So right now in North Carolina, per the Department of Health and Human Services website, we're at 1,584 cases. Looking at sort of some of the more live updates, those cases, it looks like we're at approximately a little over 1,700 now. The Department of Health and Human Services reports at least 10 deaths and 204 hospitalized. And then they're reporting that we're over 26,000 completed tests for the novel coronavirus.
And how do you think testing is going throughout the state? I mean, in terms of, I know that tests are having to be, I guess they're saving the tests for the sickest. Do you think we're getting any better in terms of the amount of tests out there for the general public? I know most hospitals and doctors' offices are still just using swabs and sending things to LabCorp and Quest. Do you think we're getting any better in terms, not just in North Carolina, I guess nationwide, in terms of testing?
Yeah, so I think things are getting better. I can tell you sort of anecdotally kind of what I'm seeing as a practicing physician, that our turnaround times are getting faster from LabCorp. I think hospitals have come up with sort of innovative ways to improve their testing. So I can give you an example for us. So what we came up with, because in general, LabCorp, we're using LabCorp. That's general knowledge. Most hospitals in North Carolina using LabCorp. And so what we did was we came up with a priority process that allows certain tests to get expedited quicker. Somebody who is obviously admitted, if somebody's admitted and, is certainly sicker, their test is, certainly a little higher priority than, somebody who's kind of walkie-talkie doing well. So we've come up with some processes to help kind of work around some delays and lag time. I think probably other hospitals are finding other innovative ways. There are some rapid tests that are being deployed in North Carolina. And I would say that I think our department will probably be getting those fairly soon.
And how is your hospital, and what are you hearing from other hospitals in the area, in the statewide? How are we doing on N95 masks and on ventilators?
As far as I've heard, as far as the state goes, I mean, everything right now is doing well. Obviously, this is mostly in its infancy here. Obviously we're not at, levels where we see in New York and some other states that are having a lot bigger issues with this right now. But as those IMHE models suggest, that it is coming to North Carolina soon. And so, I can tell you that at our emergency department, we've made significant upgrades, and the number of ventilators we're keeping in the ER. We've partitioned certain rooms off, so we basically have a room where we had put in your breathing tube, and then we would get you stabilized in that room, and then move you to 1 or 2 other rooms. So we'll have the capacity to handle at least 5 intubated patients at one time in our emergency department. We've got all the supplies down there ready to roll for that. Extra, you put in the breathing tube in this situation with a video camera. So basically you use a little lighted video camera that pulls the tongue out of the way and exposes the vocal cords. And then it really is kind of like playing a video game to maneuver the tube right into the vocal cords. And so then once we get them stabilized, they would go somewhere where they could hold for ICU admission. So we've got all the supplies we need. I think we're very well prepared, certainly at my shop. And I feel very good about where we are. Obviously I don't know a lot about the other facilities, but I can confidently say, being closer to all the Novant emergency medical directors, that I feel like Novant has done a good job of making sure we have the supplies we need and that we're all very well prepared.
And you feel confident in that as we, you gear up and you believe what you're hearing in terms of the charts and when we're supposed to peak in the next couple of weeks going in towards the end of the month in May. I mean, is that when you think the peak's going to be? And do you say you feel confident, at least in your department, that you guys will be ready for the peak?
Yes. I mean, so I do think that the projections for North Carolina are accurate. You can already tell that, the live tracker update says we're up to 15 deaths. Now, that may or may not be 100% accurate, but it usually is. And so if that's accurate, then, our number of deaths has doubled just today. So that's kind of what we're going to see. So I do think the projections are accurate. I do think sometime late April, early May is when we're going to see the peak of this. And hopefully North Carolina, if the projections are accurate, which again, I think they are, we can kind of be out of this by July, which is, pretty much based on what China did, would be about right. It took them about 4 months to kind of get to recovery mode. So I think that can be what we would expect, being that we started seeing cases in North Carolina sort of in early March.
So you think by July, we will be what you call recovery mode? Do you think we will be still seeing cases just dwindling down, or do you think by July we'll be completely out of the woods for the time being?
I think we'll be kind of where China is, where there's at least not any new cases. The question will be, in places where the outbreak is worse, kind of like New York, how long does that take? Do we restrict travel, from people from New York, or other places where there's still hot spots? A lot of that depends on how, that approach occurs. So in China, there's still new cases, but the vast majority of them are people who are coming back into the country. So that's kind of what we got to be careful of, is that we, do this correctly. If you look sort of back at past issues, like with SARS, for example, in Canada, they had done well with it and eliminated it in Toronto, and then they relaxed the restrictions a little too early, and then there's a second peak. So you have to be really careful how we reintroduce normalcy into our lives.
Dr. Bream, we have a few questions from our listeners. The first is from Jacqueline. She says, do you think our shelter-in-place order will have a positive effect on our expected peak in North Carolina, or were we too late?
So I think it'll help. Unfortunately, I think and this is again, any opinions I express are my personal opinions, and you don't represent the opinions of, any of my employers. But I do think we were probably a little late. We did the shelter in place order when we had, over 1,000 cases. So, but it's going to help. It absolutely will help. What we'll see, because this, virus can, be in your body for up to 2 weeks before you're showing symptoms. We will probably not see the effects of this for a few weeks. So that's going to be difficult to track. Certainly, you won't see any impact today, but we'll have to see kind of what the impact of it is in 2 or 3 weeks to see if that curve. The big thing will be, will that curve start to flatten in 2 to 3 weeks? And if it does, then we'll know that our stay-at-home executive order has been effective. But I anticipate it will have positive effects.
Exactly.
Gotcha. Another question from Felicia. She says, what area in North Carolina is the most highly infected? Based on what I had seen earlier, probably about 25 to 27% of the cases were in Mecklenburg. You can correct me if I'm wrong, Dr. Bream.
Great question. So this is actually one of the things I tackled in my daily update on my Facebook post tonight. So I broke North Carolina down by the 3 largest geographic area, or the 3 large metropolitan areas. So the Mecklenburg County metropolitan area. So I included Mecklenburg County, Gaston County, Union County, Cabarrus County, Iredell County, and Rowan County. And so they account for 616 out of the 1,584 cases reported by the Health and Human Services website. So I think that was 38% roughly. And then the Raleigh-Durham area, Wake County, Durham County, Johnston County, and Orange County had 375 cases, which, if I remember, was around 21% of the cases. And then Guilford County, Forsyth County, Davidson County, Alamance County, and Randolph County, the Triad Metro, had 146 cases, which was about 9.2% of the cases. So doing the quick math in my head, I can't remember. I think it came around the 71% of the cases were in the 3 largest metropolitan areas. And I was actually talking to a friend of mine who's really involved with the ECU this morning. He's a great thinker about things, East Carolina University, Pat Lane. And I was actually emailing him back and forth this morning. And, I kind of have an airport theory on this, that you're seeing these cases, around areas with airports, because obviously this is where people are traveling in and out of. Business people are coming from out of town. And so obviously, they're the 3 largest cities, but it's also, where the airports are located. I mean, if you look, it's hard to say if it's an airport or it's just the metropolitan areas, but, the places that have, Detroit Wayne's a Delta hub, Atlanta's getting hammered, that's a Delta hub, Charlotte's getting hammered, that's an American hub, all the major airlines hub in New York City. So areas where there seems to be hub cities for airports seem to be getting battered pretty hard.
Yeah, I got to follow up to that. Talking about areas affected in places in metropolitan areas and airports, community transfers of the disease. I saw a story earlier where there was 2 employees. I don't remember where the Lowe's was. It may have been in the Charlotte area, where 2 Lowe's hardware employees have tested positive. You look at that means they could have infected numerous people, numerous customers, et cetera. Hopefully not, but it's possible. So, community transfer. And then at the prison in Greene County, a guard tested positive. And again, obviously those people are isolated, so if he infected them, they can't get out. But how are we doing, do you think, with community transfers in terms of people transferring it locally amongst family and friends and out in the general public versus, like you said, airports?
Well, I mean, North Carolina is considered to have widespread community transmission at this point. So, I think at this point, I think what we're mostly seeing is cases that are transferred within the community. And anecdotally, I can tell you that's what I'm seeing. People, like you said, people are going out, people are going to meetings and confined spaces, those kinds of things are just, are the ones who are coming down with it at this point. But, when it was all said and done, reading the study out of China about this, only when it was all said and done, I think only 30% or so, it was like somewhere in the 30%. So I think it's 38% had some evidence of travel history that may have been involved. So, I mean, the vast majority of the cases are going to end up being community transfer.
Dr. Bream, our next question is from Judd. He says he works as a first responder and his wife's an RN for a medical facility that deals with more outpatient type of services. At what point does an essential worker say, I'll move out or stay in a different location than my home to prevent the spread within their immediate family without having any symptoms?
Yeah, that's a great question. So that really depends on your personal preference. I can tell you, I've made some definite lifestyle modifications. That my wife and I, we're still, of course, I've been working so much. My wife and I pretty much been socially distanced from each other anyway. With basically night shifts and basically meetings and stuff. I've basically stayed socially distant from her more or less, but when I come in, I come through the garage. I take we put a separate hamper out there, and I have changes of clothes out there. So I go in there, put my scrubs in the hamper, take a shower, and then I leave my work shoes out there at all times. They never come in the house. I make sure that before I leave work, I clean everything. My stethoscope gets cleaned before I put it in my car. My cell phone gets cleaned. My keys, anything that's going to come in the house gets sterilized before I leave work. There are lots of people in the medical community who are doing those, sleeping in separate rooms, all those sort of things. I think that kind of comes down to, personal preference. A lot of that is also, would depend on, if you have family members who say you lived, with a family member who had, some sort of immunocompromised condition or, something like that, that would certainly impact those decisions. My wife, is pregnant, but we do, like even if we're just sitting on the couch, I mean, we make sure to socially distance on the couch, so we've definitely made some modifications, but, it like you said, it's best to kind of, if you're just hanging out, you just stay 6 feet from each other and all that good stuff. But it ultimately becomes a personal decision. But, I don't, if there are lots of healthcare professionals who are doing that, if you're doing, I would certainly say it's not wrong. But, it ultimately becomes a personal preference.
Dr. Bream, our next question is from James. He says, what are the typical first symptoms that one experiences, and how does one distinguish COVID-19 from the cold, flu, or allergies?
Another great question. So the first symptoms people are generally experiencing is a sore throat, fever, and cough. And so those are generally happening somewhere around, kind of 2 to 3 days in. But generally just some fatigue, myalgias. And one of the things that's really starting to increase that people are talking about, and you've probably seen some reports about this out in the mainstream media, is that people are talking about your loss of taste and your loss of smell. So that's definitely one thing that you don't see with the flu. The symptoms for this generally seem to be a little bit more gradual, just kind of like, I don't feel well for a day or two, and then you'll get generally a sore throat, fever, and some cough. And then, generally and most people stay at that stage. I do want to talk about this just for a minute, that most people stay at that stage where they have mild illness, and they don't, progress any further. Like I said, at least, 85% of people just have mild illness or no symptoms. They do well, they recover. And as far as we know, there are no sort of long lasting issues. But then if people are going to start getting sicker, it usually seems to be around day 6 or so that people start to get, where they're feeling short of breath and those kinds of things.
Do we have any idea about the underlying conditions why some people that are seemingly healthy and not that old are having problems with this in isolated cases?
Yeah, no one's really sure. It's just, I think with any illness and any virus, you see perfectly young, even with the flu, I mean, there are some perfectly young, healthy people who end up dying from it. It's just, sometimes your body's immune response just doesn't, take care of the illness. So it's really hard to say for exactly, but we do know from the studies that There are several, hypertension, cardiac disease in particular really seems to be the one that is the biggest risk factor. But hypertension, diabetes, COPD, all those underlying illnesses really seem to, increase your risk of, significant illness.
Our next question is Jessica. Jessica says, for the 80% of infected people who don't have complications, how long does the disease take to get over from the first day of symptoms to either the last day of symptoms or a negative test? Second question, are positive cases receiving a second test to confirm they are well after symptoms go away?
So the first question, generally about a week. That's kind of what the state has recommended, and most guidelines say that. What I advise patients is that they need to self quarantine. Obviously, especially if we call it, but they need self quarantine regardless if they have symptoms, and we're calling them with positive and negative results. I think one important thing to know is that there are false negatives out there that you can have false negative tests. The data I've seen is that the sensitivity to test is somewhere between 70 and 80%. I think it's getting better. So 1 out of every 5 cases or so, it could be a false negative where you could have symptoms and test negative. But you certainly need to self quarantine. And what I tell people is that they need to self quarantine for a week, and until they've not had a fever for 3 days, and until their respiratory symptoms are improving, so a decrease in their cough and so on and so forth. So I tell them those it's not an or thing. You have to have all 3 of those things. It has to have a week. Yes, it has to have been a week, and you couldn't have had a fever for 3 days without any medicines, and your cough and your other respiratory symptoms have decreased.
What was the second part of that question, Bubba?
And the second part was about how are we? I think it was about how do we know when you're negative? Is that correct?
Yeah. The second part of the question, are positive cases receiving a second test to confirm they are well after the symptoms go away?
That's a great question. I'll be honest with you. I'm not 100% aware of that answer. That's a question I would pose to the North Carolina Department of Health and Human Services, and would ask them to consider making that clearer. Is what exactly constitutes a recovery? Does it mean a negative test? Does it mean symptom resolution? My guess, and this is an educated guess, is that being that there's a testing lack in North Carolina, I highly doubt we're second testing people. That's just a really good guess. I would say it's symptom resolution.
And the CDC recommends 2 negative tests in a row after someone's positive, correct?
That is what they've been using as discharge criteria in other countries. Yes.
Good.
Next question is from Mark. Mark says, do you recommend wearing a mask? Is it really making a difference on either side?
So for healthcare workers, absolutely. Because we're just exposed to this at all times when we're at work. And so actually, where I work, we have a universal masking policy that if you're at work in a patient care area, that you're, wearing a mask at all times. This is a standard surgical mask, not an N95 mask. And as far, the CDC and other, as far as I'm aware, the CDC and other organizations are not recommending the general public to wear masks. Unless I've missed something in the past day or two. Admittedly, I've worked like literally the past 5 out of 6 nights. So it's kind of been work, sleep, eat, meetings, sleep. So I certainly could have missed something. I'm going to be freely honest there, but I haven't seen anything to suggest the general public should be wearing masks. Because in general, if you're in the general public and you're practicing social distancing, you're not going to be in range of where an aerosolizing particle should, come near you. If you're generally talking, particles generally only go about, a foot or so. So that could be fairly low risk.
I'll follow up to that. If you do have surgical masks, not N95s, but just regular surgical masks, or mask maybe you wear to mow the grass to protect yourself from pollen, and you feel more comfortable wearing them to Walmart, will they provide any protection if you were to get in close contact with somebody?
They're better than nothing. the studies on this show that they're better than nothing. I mean, a little bit better than nothing, but there's a study looking at sort of N95 and 2-ply masks and cloth mask, and it really suggested that cloth masks really just provide minimal benefit, but I would say it's probably better than nothing.
Essentially, a bandana would do the same thing.
Correct.
Next question from Steven. He says, can someone be a carrier of the virus and not have any symptoms?
Absolutely. And that's kind of, one of the big worries with this is that a lot of people, the numbers are all over the place on what percentage of people are asymptomatic with this. You'll read some as low as 15%, some as high as 50. But yeah, they definitely can be asymptomatic and still spread the coronavirus. So that's really one of the biggest things, and why social distancing is such a big deal is because you may not know that you're infected, and then you get close to somebody who is susceptible, and then they end up getting the infection even though you don't get sick. That's definitely essentially the point of social distancing. Kind of one of the interesting things I've read in the medical literature is suggesting that multiple people, and sometimes some of the estimates of this are up to 50% of the asymptomatic people have findings of coronavirus on the CT of the chest. So that even though you're not having symptoms, you're still seeing CT findings. So that's also, worrisome. That's something that will have to be monitored in the long term.
Interesting.
A question I had, John, obviously last Friday, Governor Roy Cooper put the shelter-in-place order into effect. And so that means, obviously, people with the essential jobs, they can go to work. People that need to go to the doctor, people that are going to the grocery store, drugstores, those types of places, they can do those things. But one of the things you've heard a lot in the media, you're hearing people from different media outlets encourage folks to support their local businesses, whether it's restaurants or what have you. So that's obviously the main thing, the restaurants and just places that are offering the takeout, the curbside service and delivery services. What are your thoughts on that? Do you think that's something that people should be doing?
Well, that's a dicey question.
Yeah.
So, I mean, obviously, the advice is to stay, at home as much as possible. Now, granted, I think if you are literally just you are getting in the car and you're going to, get, something to eat, and, it's a curbside delivery thing where like literally they just have it outside, waiting for you, or, you go to like a table and, you prepay and you pick up your order. I mean, I think the risk of that is significantly low. So, I mean, I think that's probably okay. I mean, I'm not going to, I live a life on the go. Going to, I live an hour away from where I work. So, on the way home, I'm usually hungry. And so I'll stop at, Chick-fil-A or something. I think it's okay, to generally, go through a drive-through to pick up something, curbside delivery or, something like that. I mean, I think the risk of transmission from something like that is very small. And if, I think that obviously if the state of North Carolina had significant concerns that there's going to be spread or risk of that, then they would have, closed those down too.
And along those lines, John, I was just going to Walmart and looking at cars at places like Lowe's, et cetera. I mean, I this is just my opinion. I mean, I don't know what you think, but I think people have got to work on that, and there are essential businesses, but I think we might need to redefine essential if we really want this shutdown to work. Because you got too many people in stores, and there are some places open. I just wonder why they're open.
Right. I think that would be, a fair concern, but that's certainly it's out of my league there, Kyle.
Next question is from Josh. And John, this is something you touched on a little bit earlier, at least to some extent. But Josh would like to know when you foresee the crisis stage of the coronavirus ending.
I think the crisis stage will probably end somewhere, in June, probably. If the big peak happens, sometime late April, early May, then, we'll see, the cases start to gradually decrease probably by the end of May and June. And really, level off by the beginning of July. Like I said, I do think those are accurate. I think one thing to think about those, while those numbers will start to trickle down, these people are staying in the hospital for a really, really long time. So the number of cases going down will not significantly alleviate the bed crunch in hospitals for quite some time. Like generally when people go in a hospital, you do come in. Heck, I mean, if you have a heart attack, I mean, you're in the hospital for like 36 hours now. But these people who are coming to the hospital, they're staying in for months at times. So even though the case numbers are going to peak and go down, the bed curve is going to remain high for quite some time. It's going to take it a significantly long time behind it to start going down. So even though you're going to see the number of cases start to get lower and the number of new cases, the effect on hospitals is going to take significantly longer to diminish.
Let's talk about the sanitation process a little bit. Mark would like to know, would, quote, deep cleaning or professionally sanitizing a workplace, specifically a manufacturing environment, be satisfactory in order to reopen a business for production?
It should be. A lot of these places, have these, industrial. So it's kind of what we use in the hospital. So we have these things called HEPA filters, and basically they work by some sort of, electromagnetic conduction to filter the air, and they pull, all these particles out. And depending on how large your room is, you just figure out what size HEPA filter you need by, how large your area space is. So, and they obviously make them from, filters that filter a small room, the filters, that, can clean, larger areas and rid the air of the virus. So, yeah, I do think that there are certainly sanitation processes that can be followed to get people, back to work, safely. For, we do that, in the hospital, obviously, and this is, general information that, would happen in any hospital. So I feel comfortable sharing it, is that, we have the rooms that we do the highest risk stuff in. So put in breathing tubes and those kinds of things. We generally have those filters in the room or have the rooms under negative pressure, where, basically those particles are being filtered out of the air, every, depending on the size of the HEPA filter, anywhere between every 15 minutes and every hour. So it's certainly very possible. And then, we have, we're sanitizing each of those rooms after, each use, with a, terminal clean. So, there are definitely processes in place that can, get you back to work safely.
We have a question from James in Southern Mississippi. He would like to know, obviously we've never seen anything like this before, not even close, but is there anything you can compare it to?
Nothing that I can say I've seen in my career, in particular. So I graduated from medical school in 2009. So that's kind of, when the H1N1 was going on, but before I was a resident, I believe. Yeah. So I think that was in the flu season of 2009. So I was unfortunately I'm just barely young enough to not really have remembered, the swine flu, epidemic. But, that seems to be what, most people are, comparing this to. But, I don't know if it's really an accurate comparison, because obviously the swine flu, afflicted, 60 million people. Although, the number of people that died from, swine flu is actually less than in a general flu season. So it proved to be highly infectious, but not as deadly as the general flu, thankfully. So I can't say in my personal career that I've seen anything likely like this to compare to. And I don't think, other than H1N1, it's been, a long time in America since we can say we've seen anything to compare that to as well.
Yeah, and actually, I had H1N1. My wife had H1N1, and my nephew had H1N1 when it was going around.
Yeah, and it's still out there. I mean, don't get me wrong. When we do, respiratory panel, when we had been doing, anecdotally, some respiratory panels on patients, kind of early on this, we were seeing people who were still testing positive for H1N1. I mean, it is still out there. It's a, part of the seasonal influenza virus. It's always out there.
We have a question from Krista. Krista would like, or she asked, now that it's here, what does this mean going forward? And once the cases slow down, what will the summer next fall look like? Can we expect it to rise again?
Yeah, that's a great question, and I think the honest answer to that is nobody really knows. So all we can really do is kind of look to see, well, what happened with other novel coronaviruses like SARS, the first SARS, and then what happened with MERS, Middle East respiratory syndrome. And so from what I've read, the kind of the consensus on this is that the first SARS just kind of mutated into a lesser virus that wasn't nearly as deadly. That's certainly what I read. And then MERS still exists out in the Middle East as a kind of a common virus, or a seasonal virus. So I don't think anybody knows. If I were guessing, and this is just me giving you I guess, I'm hoping that, social distancing and whatnot, that we will stamp this out. But I would just say I wouldn't be surprised if this ends up becoming a seasonal virus. But again, nobody really knows that for sure yet.
Yeah, Dr. Fauci or Felci, I never say his name right. You know what I'm talking about.
Yeah.
He thinks it's coming back in the fall.
Yeah, if you had to, pin me down to an answer, I would say, yeah, I think that would be what I would guess. I would say I think it's probably more likely to come back in the fall, and I think that's most of the consensus, and that's where these vaccine trials are going to be really, really important. But that's still probably a year away or so.
Will we play football this fall, John?
Will we play football this fall? Yes.
I'm holding you to this answer.
I would anticipate so, but I think it'll be on a altered schedule. I don't know. This is, again, we'll stop football here for a second. It seems like maybe we could push. There's no reason that you've got week 0 has to. Week 0 could be the second week in September. All you're competing with is NFL football, and that's on a completely different day. So I think as long as and the bowl games don't, bowl games go into January. So eliminate some of these early bowl games. Extend the season, and get it done. Or compress bowl season, have, 3 games in a day every day instead of having the Camellia Bowl on ESPN2. You know what I mean? Just have more bowl games compressed, have them back to back on, several different networks. But yeah, I think they can, I think they'll find a way to get it done. I think, being frankly honest, with NCAA, there's too much money at risk for them to not have college football season. If the curve is leveling off, they'll find a way to get it done.
And not to get on the sports discussion, even though we are a sports executive podcast, but you take schools like East Carolina and other Group of Fives. I don't know what would happen if we didn't play football this fall. I don't know that budget wise, we might not have an athletic department.
Yeah, that's definitely a concern. I posted an article, I think it's in Triangle Business Journal, that talked about sort of the effects that it's going to have on college campuses, in the in UNC, Duke, NC State, all those schools. And it's not in this be more of a discussion of kind of what the coronavirus is doing to the economy in general. But you're now having to fund athletics fees, dorm fees, campus recreation fees, all these things are getting refunded. And so this is major loss of revenue, not just for the athletics departments at these universities, but to the to just the from revenue of the university from from tuition and all those kinds of or not tuition because they're still online classes, but from other sources of revenue for a university. So if you're really not in a strong revenue position, the university ultimately, and a lot of it functions as a business. You've got to, while the taxpayers do subsidize it to a degree, you can't run at a major loss. But so it's going to be very interesting to see what happens. I think, I read some estimates like, $300 million loss universities. It's just going to be massive losses, and we'll have to see, kind of, what ends up happening there. But, to ECU specifically, we all know here that, ECU wasn't in the best financial position to start. And I think it's time to start making some hard decisions. It's probably time to cut some sports. If you want my opinion, it's
Glad Dave's not here right now, John.
All right. it's probably time to cut a few sports. We're going to have to do what we can, to survive. And I know cutting sports is an unpopular.
No, nobody wants to see it, but
if nobody wants to do it, but it kind of gives you an excuse to do it. We field, what was it that we field more sports than everybody but UConn in conference. And
now that
UConn's
we field the most. Yep.
Right. Yeah. So we'll field the most with the second smallest. Well, I guess Tulsa and Wichita State have smaller budgets. So with the third smallest budget, we field the most sports. It just doesn't make sense. So that's where I'll leave it there.
John, we have some other questions.
Sure.
Mark would like to know, how would you rate where our confidence should measure in regards to the data and validity of the stats we've received from China thus far? And do you think even their own people know the real numbers?
So that's a tough question. So I'll kind of answer it in two parts. I think everybody knows that China was not forthcoming when this first started. I think there's probably universal agreement in that. So I would say, as far as the general numbers, I would maybe have moderate. If I was reading a low, moderate, or high, kind of moderate confidence. You read some of these things about 20 million people's cell phones plans are now, 20 million people's data is gone. The number of earns far exceeds what they're reporting the death toll to be.
I mean, they reported 3 million deaths, John. I mean, there's no way.
Right. So, I think it's probably, I think now, do I think that they're giving us right numbers now about, new transmission and cases like that? Yes. So that's kind of why I'd say moderate. That, I think that it probably wasn't very accurate to start, but I do think it is probably better now. Now, I do have, confidence in their scientific numbers. When I'm looking at reading studies and stuff like that, this is new in the Western world, but in the Far East, now they've had months to look at this. And so, the stuff that we're, basing our treatments on and everything like that, all came from there. So I do have, pretty good confidence in their scientists that, they're not, publishing things that aren't factual and all that kind of stuff. So, I think, so overall, are the general numbers accurate? Probably not, but I have, better confidence that the recent stuff that's coming out is better. And I have, high confidence in the studies. And obviously, JAMA and Lancet and all these other, highly regarded journals would not be publishing their studies if they thought they weren't very good or weren't trustworthy.
John, a question pertaining to the schools. Obviously, every school system around the states handled it a little bit differently in terms of whether they're taking the lunches to the kids or whether they're having the parents come and pick it up at the school. Here in Rowan Salisbury schools, both options are being offered, and they can go to the school for a 2-hour window, or the lunch is being taken to them, or actually breakfast and lunch. So what are your thoughts on that?
Well, I think the, unfortunate reality of that situation is that, if this wasn't happening, we'd have, kids that are going hungry. So, it's just kind of to me, I think this is more of a humanitarian issue. It's just sort of, by any means necessary. But I did read, the great article, at Rowan Salisbury schools with the buses delivering the meals and all that stuff. I think they're doing good work there. But, it's just, it's definitely a humanitarian need in North Carolina because, unfortunately if this wasn't happening, a lot of kids would be hungry. So I'm proud that even though the students aren't in schools, that the school systems have stepped up and really have helped make sure that students are still getting to eat.
Yeah, and let's give a shout out to one of the volunteer bus drivers that's taking these meals to the kids, and he doesn't have to do it because he's a teacher and he's doing it because he wants to.
Right.
Our own Bubba Rosenbaum.
Right. Yeah, and so we're seeing. I think this is a great time to highlight that even with the coronavirus pandemic and how it's affecting people's lives in a many different ways. A lot of people are losing their jobs, and a lot of the spirit of volunteerism is seen. A lot of people are making cloth masks for hospitals. American ingenuity is on display. People are creating all kinds of new things to help us as healthcare workers stay safe. Big props to all the people who have, really risen to the occasion to do great things in their communities in difficult situations.
And then while Bubba's out volunteering, taking lunch to children, and you're saving lives there at the hospital, I'm doing my part by staying my ass at home.
Great job, Kyle.
Dr. Bream, a question. Obviously, one of those essential reasons that folks are allowed to leave home for is to go to the grocery store to get things they need. If going to the store, do you think it's necessary for an individual to spray their groceries with Lysol or wipe them down with disinfecting wipes before bringing them into their home?
And my sister asked that question, Bubba.
No.
Oh, Stacy asked it. Your wife. Okay. All right.
So are you talking about certainly wipe your buggy down and stuff like 110%.
Yes.
Are you talking about wipe your groceries down before you bring them inside?
Right. The actual groceries.
The packages.
I think it would probably be the safest thing to do. Whether it's overkill or not, who knows? But it's not gonna hurt anything, that's for sure. Wiping it down with a alcohol-based wipe or something like that. It would definitely decontaminate your groceries. But I guess that is a reasonable thought that somebody could cough on their hand and then grab the bottle of the milk jug and then put it back down or something. So yeah, it's not going to hurt anything.
Would just spraying them with Lysol spray work? Aerosol Lysol spray?
Well, you probably need to, that would probably miss a lot of the jug, but I probably would, spray it and wipe it down real good.
Okay. Let's see.
Your wife, Stacy, right now is just, I can see her in the background making a face at Bubba.
Yeah, I thought to say, Stacy, get your finger out of my face.
It might be overkill, but it's definitely not going to be harmful.
Yeah, definitely better safe than sorry, and that's definitely her policy. But
right, exactly.
Another question she has, she said, I've heard that vapor particles from the virus can live in the air for quite some time. To me, the distancing measures we've been applying wouldn't fully protect us. Is it true the particles can live in the air for a period of time longer than a few seconds?
So I'm going to tell you right now, I'm not 100% sure of the answer to that question, because this is stuff that started coming out last night. I'm aware that there was a researcher from MIT that has said this. Now but I'll be honest with you, between working overnight and sleeping today and everything, I've had 3 conference calls this afternoon. I haven't got a chance to look at that data yet. I apologize.
This question is from Jessica Barber. Can you have the virus without a fever, and should we just avoid taking ibuprofen even if we don't have the virus?
Yes, so you can definitely have the virus without a fever. That is, we're seeing that, especially some of the articles talking about in pediatrics that up to 60% of the kids don't have a fever. So you can definitely have the virus without a fever. You can have low grade fever. I can tell you, in reviewing case presentations that they've kind of been all over the place. I would say that the majority of adults have a fever. Certainly, the sickest people have a fever. But you certainly can have the virus without having a fever. Cough, sore throat are kind of the predominant symptoms of fever. Definitely happens. It's just usually a little bit later, not much later, like within 24 hours. Like I said, but it's very common. Over 80% of people have a fever with it. Like I said, but in kids, it's definitely not as common. And then what was this is Barbara's second question?
Ibuprofen.
Oh, that's right, ibuprofen. So this is kind of how I look at this. It has been all over the map on this. Some say yes, some say no. There's no definitive literature out there that suggests that you can't take ibuprofen with this. And in theory, so sort of the nerd discussion of this is that this virus enters the cell by binding to ACE receptors, which are expressed in the kidney, the lung, the heart. And so basically, in theory, ibuprofen would increase the expression of those receptors so that it could potentially cause the virus to be more powerful, for lack of a better explanation. And so it's all theory. None of the leading health organizations I'm aware of, and again, I've been working a bunch past few nights, but I would think that would be a mainstream media article.
Correct.
Are recommending to stop. So this is what my general approach to this has been. I would try Tylenol first, for sure. Like if you have aches and pains, you've been working out in the yard and your neck hurts or your back hurts or something like that. Yeah, I would try other intervention, Tylenol, heat, other, Tylenol, non-pharmaceutical interventions first, stretching and all that stuff. And if that doesn't help, then by all means, take a Motrin.
Yeah, and I talk about medicine. Forgive me, I'm terrible with you'll know the medicines I'm talking about. The malaria medicine.
Yeah.
I read an article today about a lady in New York who was doing terrible. They started her on the malaria medicine and with another medicine. It was a combination of two medicines.
Yeah, Plaquenil and hydroxychloroquine.
Yeah, the next day her fever went down and she was discharged 7 days later.
So I've reviewed sort of all the studies on this, and I've posted them all on my Facebook page. So not to be like shamelessly self-promoting or anything, because I'm not, but basically, I've been posting factual updates pretty much every day, and so this is a hot topic, the Plaquenil, azithromycin, hydroxychloroquine combos, and so there's small, so I think there's an important thing to note here. They're all small studies. And so I think they're kind of just suggestive, but not definitive. So the first study was out of China. It was very small, 30 patients randomized, 15 to each part of the study. And, with, hydroxychloroquine and no medicine, and there's no difference. The second, well, actually, it's really two studies. There was the first study. The second study is like a continuation. So the writers out of France enrolled 42 people in the study, 26 people in the treatment arm, and then 16 people in the control group that didn't get hydroxychloroquine or hydroxychloroquine and Zithromax. And so basically what they did was they said, well, the 20 people who got hydroxychloroquine or hydroxychloroquine and Zithromax had viral clearance much faster than their counterparts. Than the control part. But so you have to read the study. This is where studies, you have to be really careful about reading them. And while peer review and refereeing them is very important before they get taken to the mainstream, is because what they don't tell you, and that what they would tell you is authors' conclusions is that 20 people in the treatment arm had much faster viral clearance than the 16 people in the control arm. So that sounds great, right? Sounds like it works. What they don't tell you is that in the treatment arm, they excluded 6 people, 1 who died, 3 who were transferred to the ICU, and all that stuff. So basically what they did is said, of the well people who got hydroxychloroquine, Plaquenil, Zithromax, some combination of those medicines, the viral clearance was faster. That also doesn't tell us anything about their outcomes comparatively. It sounds like they all did well, both groups, but the viral clearance was faster. So that obviously brings up questions about, what's important, the clinical outcome or viral clearance. So what they did, so if you have one bad study, what these guys did was like, okay, we'll make a bigger bad study. And so they took 80 people and they basically randomized them into groups based on upper respiratory and lower respiratory symptoms. And then they classified them by their NEWS score, which is basically a severity score that grades your risk of deterioration and low risk, medium risk, and high risk. And so of the 80 people they enrolled, 92% of these people were in the low risk category. So basically, like, these are the people who should be doing well anyway. Like, basically with no medicines, the data would say that, these people should be doing well anyway. And so they gave them all the medicine. So they didn't do a control study. They didn't randomize against people who didn't get the medicine. So basically, if you break down the math of the study, you would expect 63% of these people, 63 of the patients total to get better on their own. without any medicine. And then what that study showed, that was 65% of the people who got medicine got better. So basically, there's probably not really any statistical significance of people who got better with the medicine who would have been expected to get better regardless. And even with the medicine, 15 people got admitted to the hospital. A few got into ICU, one died. So what I would say about it is, so I'll give you a personal perspective. If I was sick with coronavirus, and was sick enough to be admitted to the hospital, I would want the medicine. But I don't know that I would have high confidence that the medicine would work. So kind of what I think about. So basically, if you're in a fight and one guy has a bazooka and then you've got a pocket knife, you're going to fight with your pocket knife, So you at least want to give yourself what chance is there. But so while I think these studies have been widely media circulated and painted in a more positive light than they are, it's kind of what we've got for now. So it's kind of where Dr. Fauci, with the Trump administration has, we've issued this emergency FDA clearance, but we don't really have. There's no real scientific data to suggest these medicines are going to be super helpful, and I would say they're certainly not looking like they're going to be magic bullets.
Sorry, go
ahead. You mentioned if you were a patient, you were and you were sick enough to be hospitalized, you would want the medicine. Is it available upon request? If a patient says, "Doc, I want that, give it to me. I'm hospitalized," or do they have to get some kind of special clearance, or how does that work? Can you guys?
So most of these medicines are under. Now I think this is stuff I can share generally. Is that if you're admitted to the hospital, it would be an infectious disease restricted drug, meaning that it would be something that the ID docs would have to order. But I can speak, to where I work, obviously, that we do have that medicine. We have hydroxychloroquine and Plaquenil available for admitted patients. So, and I would think that most hospitals, generally would at this point.
Okay.
Another question we had from Stephen. He says, could the coronavirus be worse on a patient who had WPW even though it was corrected within an ablation?
Whew. That is a great question. And I would say that the educated guess answer is, because obviously this is not going to have been studied in a bunch of people with WPW, is probably not. Underlying, heart damage, so basically you've had a, heart attack and you've got, cardiac scarring and all that stuff. Yes. But I would say that, WPW, is likely not going to be a significant increased risk. That's, more of a conduction abnormality and not a, underlying heart disease, congestive heart failure sort of thing.
And what about, and I'm assuming that was Stephen Casper that asked that. And what about someone, like me, just being a big guy, I have a rapid heart rate, I take medicine and propranolol to slow it down. Mm-hmm. I guess personally, I feel like with that in my history of having asthma and bronchitis when I was younger, I feel like I'm elevated risk just because of those things.
And you would be, those are things, obesity, underlying lung conditions, those are people who are higher risk. So continue to stay your tail at home, Kyle.
Okay. I'm going to say, make sure you save this video, Bubba. Okay. I do have a note from the doctor, but just in case.
Kyle, do you have any other questions for Dr. Bream?
No, not at this time. Is any more from the chat?
No, that's all the questions that we've had submitted thus far. One of the things I did want to kind of going away from the coronavirus, one of the things I did want to mention as we're preparing to get off the air tonight is just obviously Sup Dog's popular establishment in downtown Greenville, or excuse me, uptown Greenville. But Sup Dogs is battling Barstool KU at University of Kansas and is trying to win another national championship as far as Barstool Best Bar. But if you have not already voted, go on Twitter and do so. Hashtag Barstool Best Bar, hashtag Barstool Sup Dogs. So you can do that until Friday at 7 p.m. Eastern.
Yeah, speaking of 7 p.m., Saturday night, 7 o'clock, be here. You ain't got nothing else to do. You can't go anywhere. We're going to have pirate and sports trivia with myself, Bubba, and Dave. Everybody join us. We're going to be giving away Domino's gift cards, I believe, to the winner. We're going to have to get, we don't know if it is, I'm not sure. Is it the winner that gets it or Final Four, Bubba? Have we decided? But somebody's getting a Domino's gift card, and you can't win if you don't play. So be here 7 o'clock Saturday night for pirate and sports trivia here on the Sports Objective Facebook page. And I did have one more question for Dr. Bream. Dr.
And John is perfectly fine, by the way.
John, in your professional opinion, which do you think is more damaging, the coronavirus to the United States of America or Jeff Comfort, East Carolina?
Whoo, boy. Well, I want to go with coronavirus because coronavirus is literally a matter of life and death. I want to take the easy way out on that one.
Gotcha.
But John, on a serious note, a listener or viewer would like to know, as far as vitamin C, probiotics, what do you recommend, or like what do you think the impact would be in that case?
So I mean, vitamin C has been pretty extensively studied in viral infections, mostly the common cold, and basically all the the studies kind of show. I mean, the vast majority are negative or show no benefit. There's a few studies that show maybe modest benefit, but again, I would put vitamin C in the it ain't going to hurt you category. I wouldn't take it in obviously massive doses or whatnot, but I have added a multivitamin to my daily regimen. Again, I'm a big believer, not just in coronavirus, but just in general as a physician, that if it's not going to hurt you, it's okay. Like if you've got back pain, they're like ice or heat. I'm like, whichever one makes you feel better. Neither one are going to hurt you. So just things like that. So multivitamins, there's been a lot about, somebody had talked about some things about zinc. Some American diets are zinc deficient, but that, again, will be covered in multivitamin. There's some theoretical protection from zinc, but I don't, my suspicion is that, in the human body, it's really not going to play a major role. But yeah, I mean, I would put it in the category of things I'm doing because they're not harmful, but probably aren't likely to make a major dent.
Yeah, and I got a question along those lines of not being harmful. My wife had read a study earlier about something about, it sounds like nonsense to me, but something about drinking hot liquids constantly would help you from getting this, somehow keeping heat in your throat and digestive system. I don't know. It sounds like malarkey to me.
So I'll give you kind of what I guess the theory behind this is. So this virus is not very heat stable. So, much like the flu, although this is more heat tolerant than the flu, basically if you expose this virus to heat for like 15 minutes under 150 degrees, 150, then the virus will become pretty unstable after 15 minutes. So, that's why the theory, obviously with flu and with this, we're hoping the hotter weather is going to help, but it has to be persistently elevated temperatures over 80 degrees are going to be helpful. They're not going to again, they're not the magic bullet, they're not the cure all, but it will help. The other key to that is may not even be as much temperature as much as the increase in humidity. Winter air colder is drier. Droplets transmit easier, and so the North Carolina humidity, it's particularly eastern North Carolina humidity, will help somewhat. But
drinking a bunch of hot coffee probably won't.
What's that?
Drinking a bunch of hot coffee probably isn't going to do anything.
Yeah, but generally drinking a little hot coffee as minimal amount of time as that's going to transiently increase the temperature of your throat. It's probably not going to help a whole lot.
Okay.
Well, John, we really appreciate your time. We appreciate you coming on and spending a little over an hour with us. I know our listeners or viewers in this case have really taken a lot from this conversation. We've had tremendous feedback, so thank you for everyone tuning in. And this will be archived not only on Facebook, we'll try to get it on our YouTube channel as well. You can find that by simply searching the Sports Objective, and it will be archived also everywhere you typically listen to our podcast, whether it's Google Play Music, SoundCloud, Audio Boom, Live Talk Radio, you name it, you can probably find us there.
Hey, Bubba.
Yep.
Can I include one more thing before we go?
Absolutely. Go right ahead.
I hope that there's a lot of pirates. I'm sure a lot of people, but in particular, this being ECU sports direct being particularly concerned with ECU. A lot of pirates out there who are listening. So I hope that everybody heard the man Ron Mitchelson's plea the other day to help students from East Carolina who are displaced. The East Carolina Student Emergency Fund. He posted about a minute and 45-second video, really imploring pirates to do what we do best, which pirates help pirates, and for people to consider making a donation to that fund. I've not donated yet. I will be donating soon. But for people to make sure that they are that pirates do what we've always done, that we take care of our own, and pirates help pirates. So I just ask everybody out there in Pirate Nation to really listen to Ron. I mean, he's such a good guy. I think he'd be a great chancellor if he were interested. But for us to consider coming together, and those, if you're able. Yeah, I'm sure if you only donate $5, $5 is better than $0. And so would really encourage people to consider making a donation to the ECU Emergency Student Management Fund.
Absolutely. Interim Chancellor, like you mentioned, Dr. Ron Mitchelson, he's done a tremendous job. He's been at East Carolina in a couple different capacities, at least over the last 20 plus years. And so we certainly appreciate all he's done. And I would urge, just no matter what university you support, definitely do that with your school, whatever school that is. So, thanks so much again for your time, Dr. Bream. And we look forward to having you back on the show. Hopefully, we talk sports more so than the coronavirus. But down the road, depending on how this progresses, we'll certainly have you back on. And to our listeners, definitely, like I said, you can find this on all of our platforms that you typically listen to our show. It will be archived tomorrow, tomorrow being Thursday, April the 2nd. And follow us on social media, on Twitter at TheSportsOBJ, on Instagram at The Sports Objective, and like and follow us on Facebook and subscribe to our YouTube channel. You've been watching the Sports Objective podcast with Dr. John Bream, a product of the East Carolina University's Brody School of Medicine.
And now I'm
Thanks, guys. Go Pirates.
See y'all Saturday.